My name is Serena Bond. I'm one of the counselors here at Winona State, and I am just here to talk to you a little bit about our counseling services at Winona State. Before I hop into talking about our services and information regarding counseling, I first want to start by introducing the members on our team, starting with Uni. So she has her master's in social work and is a licensed clinical social worker. She's been on staff with us since 2003, and her specialty on campus has been grief. That's kind of been her niche. One of my favorite parts of Uni is she's just so warm and comforting. She makes you feel safe instantly as soon as you start talking with her. Then we have Linda. She's actually been on our staff the longest. She has her doctorate and is a licensed psychologist. I believe she's been here about 20 years. So she's got a really great understanding of kind of all the workings of the university, and just a more in-depth knowledge of other kind of areas on campus. She also used to work as an advisor to students. So she has a great understanding with classes and can help with different resources on campus. She's actually the individual that also has our therapy dogs. So you can see in the corner, Winston and Aiden there. So she does the therapy dog work. She also has a beautiful background in holistic health, which is just delightful. So she's got a lot of information regarding nutrition, supplements, things like that can assist in addressing different mental health symptoms. Then of course me, so my name again, Serena Bond. I have my master's in clinical mental health and I'm a licensed professional counselor. My niche area is psychodynamic work, which is essentially just kind of connecting past messages to present behaviors and thoughts. And it just really kind of helps students clients make a more informed choice about those next behaviors. Sometimes we have these unconscious messages that guide our behaviors. And once you can tune into those, you can have a little better understanding of like, oh, that really triggered me because of this. So that's the work that I do with students. Then we have Mick Lynch. He's a clinical and sports psychologist. He does a ton of outreach on campus. He's a well-known face. He works primarily with a lot of our student athletes and has a good understanding of kind of the different experiences that they have being a student athlete. And then we have Kateri Johnson. She's actually our director of counseling services. She has her bachelor's in psychology, and then she has her master's in community counseling, and actually got both of those through Winona State. So she has a great understanding of what it is to work here in Winona State and also what it's like to be a student at Winona State. So lots of general information about our school there. And then again, Winston and Aiden are therapy dogs there. They are just a big hit with students. Linda also has 3 other dogs, so fingers crossed that we can maybe add more to that team. So what services do we offer? So primarily we're working with students on individual counseling. So that's the stereotypical, maybe what you see in movies or shows where you're sitting with another individual doing processing by talking. Right now that looks like we're holding individual sessions either via Zoom or in person, really just depending on what client preference is. So we're able to kind of meet needs either way. We also do group counseling. That's more so based on student need. So kind of ongoing group counseling sessions that are available are grief group, and then the doggy de-stress. And then the other groups tend to kind of pop up based on when there's a higher need. So for example, when there was a lot of election stress, and that was something we were hearing a lot of students report, we opened up an election stress group. And then during COVID times, we had some other different COVID groups going on, but one thing that was reported a lot was students experiencing more isolation, withdrawing, not engaging in as many activities. So we started a couple COVID-related groups. An example is like crafting over COVID, just trying to kind of make connections in that way. So we just kind of respond to what different student needs are, what's reported to our office, and then we try to meet student need that way. We also do some like psychoeducation or outreach services to classes or other groups on campus. I've certainly done presentations for different like sororities or clubs or coming into classes just to talk a little bit about general mental health, stress management, anxiety, depression. Really, whatever the need is, we'll work to meet it. I definitely work with students as well that need different interviews with professional counselors for classes. So we're really just an email away, willing to kind of help with whatever we possibly can. You do not need a diagnosis to be seen, and we don't diagnose. This might be a little confusing. That doesn't mean that we don't work with diagnoses. Obviously, as counselors, we all have training of understanding symptoms that may look like a certain diagnosis, or if somebody has already been diagnosed, we certainly know how to work with those different diagnoses. The reason we don't diagnose is because we don't accept insurance. And we don't accept insurance to help keep those the cost of our services low. So there's actually no fees to meet with us. That is covered in your student fees, and I believe it's pretty minimal. It's like about $20 out of your student fees. So if you've never tried counseling, really now is the time, because it's so easy and it's free. You really just can't beat it. So we work with students at whatever level they're at. I've definitely seen clients that have come in and just been like, I don't know why I'm here. I just really wanted to try it and see what I thought about it. That's totally fine. Make an appointment. Or I've worked with students that have a long-standing history working with counselors. So whatever level you're at, stop in and give it a try. Now is the time. All of our records are completely confidential. It's not part of your academic record. So professors, campus staff, parents, other students don't have access to our records. And we won't even indicate that you're being seen unless there's a risk to your safety or others. Sometimes there's fear that comes with seeking a counselor on a college campus, that maybe somehow there's different rules, but it's really not. We are just like your standard community counseling program. Confidentiality is just the foundation for us. Privacy is so important. So there's no difference from any other counseling service. Students can have up to 6 sessions per semester. If a student would like to be seen more frequently, we can certainly help with a referral. So we keep up to date with other counseling services in the community. So we have a good sheet of like, how soon can you be seen at this counseling office, or what does the wait list look like here? This counselor in the community specializes in this. So if there's anything that we can't provide for a student, we'll certainly help them get connected with somebody that can provide that. The reason that we put a 6-session limit is just because there's 6 of us on staff, and there are many, many more students than that. So that kind of helps prevent us from having a wait list or not being able to meet other student need. It just helps so everybody can have services available. So appointments are required. And occasionally, when we are in kind of our busiest time, there may be a wait of about 1 to 2 weeks, 3 at the most. But if there is a mental health crisis, something like a client who's suicidal, a recent sexual assault, or even a recent loss, a counselor can meet with you that day. So we do have walk-in crisis counselors that are available to meet with a student in crisis that same. And that's about all the information that I have. If you certainly want to recap on some of the things I discussed or wanted to learn more, you can check out our WSU Counseling Services website, and I have the link there for you. If you wanted to chat with an individual on our team, you can certainly also email us at counselingservices@winona.edu.